The latest breakthroughs in diabetes, treatments, technology, and global impact. Diabetes continues to be one of the most pressing global health challenges, with over 537 million adults living with the condition worldwide. However, 2025 has brought exciting new breakthroughs in treatment, technology, and awareness that could reshape the future for millions living with diabetes. In this video, we explore the most recent developments across the diabetes landscape, from innovative medications to cutting-edge technology and rising global concerns. The growing global diabetes crisis. The prevalence of diabetes, particularly type 2 diabetes, T2D, is skyrocketing in many parts of the world. In Africa alone, the number of adults living with diabetes has jumped from 4 million in 1980 to over 23 million today. A combination of urbanization, dietary shifts, and genetic factors is driving this surge, with many people remaining undiagnosed or untreated. In response, the International Diabetes Federation, IDF, recently introduced the concept of type 5 diabetes, also known as malnutrition-related diabetes, which affects an estimated 20–25 million people in Asia and Africa. This recognition aims to drive targeted research and better treatment options for vulnerable populations. Promising new diabetes medications. 1. Orforglipron, the next-gen oral GLP-1. A new pill known as Orforglipron is showing promise as a non-injectable alternative to drugs like Ozempic and Wegovy. In recent clinical trials, Orforglipron helped patients significantly lower their HbA1c levels while also achieving substantial weight loss, up to 7 kilograms. The pill could potentially revolutionize diabetes care by making GLP-1 receptor agonist therapy more accessible and convenient. 2. MariTide, a once-a-month diabetes and weight loss shot. Pharmaceutical companies are developing MariTide, an injectable GLP-1 analog that only needs to be taken once per month. Early results show an impressive 16% weight reduction and improved blood sugar control in patients with type 2 diabetes. This long-acting treatment could enhance adherence and quality of life for many people living with chronic conditions. 3. Repurposed psoriasis drug for type 1 diabetes. Researchers from Indiana University are investigating a repurposed psoriasis medication that targets an inflammatory protein linked to type 1 diabetes, T1D. The goal is to prevent or delay the progression of T1D in newly diagnosed individuals by protecting the insulin-producing cells in the pancreas. Technological innovations transforming diabetes care. 1. 3D printed insulin-producing cells. Scientists recently unveiled 3D printed islet cells that can produce insulin and respond to glucose levels for up to 3 weeks in laboratory settings. This pioneering approach could pave the way for bioengineered pancreas transplants or cell-based therapy to restore insulin production in people with type 1 diabetes. 2. Smart insulin that responds to blood sugar. A breakthrough drug known as NNC-2215 by Novo Nordisk is being hailed as smart insulin. This innovative insulin formulation automatically adjusts its activity based on real-time blood glucose levels, dramatically reducing the risk of dangerous hypoglycemia. 3. Artificial intelligence and digital health tools. AI-driven platforms like GlideTwin are helping people manage diabetes by predicting glucose fluctuations and offering personalized recommendations. These tools are especially valuable for type 1 diabetes management, where maintaining tight glucose control is critical. Additionally, tech giants like Apple and Samsung are reportedly developing non-invasive glucose monitors that could eliminate the need for finger pricks entirely. Raising awareness, Barbie gets real with type 1 diabetes doll. In an inspiring move towards inclusivity, Mattel has introduced the first ever Barbie doll with type 1 diabetes. The doll comes with accessories such as a glucose monitor and insulin pump, aiming to help children better understand the condition and foster acceptance and empathy. This collaboration with Breakthrough T1D, formerly JDRF, highlights the importance of normalizing chronic health conditions in everyday life and popular culture. The road ahead, a call for action. While these advancements offer hope, global diabetes care still faces major challenges. Access to insulin and essential medicines remains limited in many low and middle-income countries. Education and early diagnosis are critical in preventing complications such as blindness, kidney failure, and amputations. Policy action and global cooperation are needed to ensure that these breakthroughs benefit all who need them, not just those in wealthy nations. Key takeaways: breakthrough impact, Orforglipron pill, easier diabetes management without injections, MariTide monthly shot, improved adherence and weight loss benefits, 3D printed islets, potential cure for T1D through bioengineering, smart insulin, NNC 2215, reduces hypoglycemia risk, eye tools and non-invasive monitors, smarter, pain-free diabetes care, Barbie with T1D, greater public awareness and acceptance. Final thought. The fight against diabetes is entering an era of rapid innovation, with new treatments, technologies, and increased global focus on equity and access. Whether it's pills replacing injections, AI improving care, or dolls teaching acceptance, these changes are reshaping the way the world understands and manages diabetes. As these breakthroughs continue to evolve, the hope is clear. A future where diabetes is no longer a life-defining condition, but a manageable one for everyone. Right Finger. Stay informed on the latest in health, innovation, and global wellness at worldwirenews.sis.